Hi, my name is Oscar, and today I'm going to share with you two stories. First one is going to help me explain you how finally I am working in health. I am an engineer, and many people ask me why I am working in health. And second one is going to help me to tell you about my passion right now. So, during my career, during all my life, I was very affected about poverty context. So when I finish my career, I accept a job, and I decide to go and work very far away from the city in the mountains, without connection, no internet, no phones, with very poor communities. I was doing capacity building to implement a small business based on organic agriculture. And it's one day riding my motorcycle, because I have to reach other communities around, riding 1, 2, 3, 4 hours. I find in the road, in this desert rural road, a man walking. So I decide to give him a ride. And I start to listen to his story. He told me that his wife felt ill, and he have to walk 8 to 10 hours to reach the next health center. He was returning to his home because he have to take care about the rest of the family, the other kids, take care of the animals he have. And at the next day, very, very early in the morning, he have to go again to the health center. And he have to do that for, the next 2 weeks. And I at that moment says, of course, to fight with poverty, it is not just about trying to make people get more money. You have to look for the social determinants. And health is one of the most important. So I don't want to say that at the next day I ran to try to find a space in a health project, but some years after, when I see this opportunity to work in health projects, I still remember that man. And when I was accepted, I was very happy, continue thinking in that man that I find walking in the road. So I start working in health. And second, the second story to talk about my challenge, my passionate, to start to talk about that, to put in context about that, I have to tell you about one of the most terrible pandemics that we have in the last century. And of course, I'm not going to talk about COVID-19, such we really know it for about 2 years. I have to talk about tuberculosis, a disease that affects 10 million persons and kill 1.5 million persons all in a year. A disease that has been recorded thousands of years, that is still among us, and very far away, that start to feel that we are overcoming it. The recent pandemic is going to make that in the next year, the number of infected people and the number of deaths is going to increase. I have to talk about tuberculosis because we don't listen about too much about this disease. Maybe because the people most affected are the ones who less have a chance to talk about their suffering. And such is the case of Ronald. Ronald, a young man that I met a few years ago, he was 19 when I met him. He started a long treatment of resistant tuberculosis. He have good days, he have bad days, but after months, he started to feel better. Maybe that's the reason that he started to be careless and irregular in the take of medications. And he became ill again. And in a short time, he lost the battle against tuberculosis and he died. I was very sad at that moment. I was very close to Ronald, but he was not alone. He lives in a small space with his girlfriend, Veronica, and they just recently had a beautiful baby named Hugo. So we have to go fast to see Veronica and Hugo, try to get for them a diagnostic to see how they are. And after a few days, we received the results of Veronica. She was not infected. But for Hugo, it takes a little more of time. Diagnoses are made for adults. And it is very difficult to ask a baby to leave a sputum to do a test. It takes like 2 weeks. And after that, we receive the results that broke all of us. Hugo have a diagnostic of extensive resistant tuberculosis, the worst of the form of tuberculosis. At this moment, I can only keep in mind one idea. He cannot die, and I repeat many times, he cannot die, he cannot die, he cannot die. We have to make everything to help him. And we accompany him all the large treatment with a very aggressive drug regimen. And finally, after 2 years, we received the final results. Hugo was completely cured. And we all was very happy at that moment. We were with a lot of joy at that moment. It was a very emotional moment. However, I must say that this story, despite the ending full of happiness, hides behind this romanticism a serious problem of social injustice and inequity in health. Hugo, with less than 1 year, had to face a health system that didn't have an appropriate diagnosis for his age, didn't have medicines in doses for his age. His mother left everything for 2 years because the hospital demands to be with the baby 24 hours with him, because nobody is going to carry him, feed him, anything. The mother has to be there. Just like Veronica and Hugo, there are thousands of stories of very poor or vulnerable persons. Many of these, after a disease like tuberculosis, have a worse condition of poverty. Because despite the fact that many countries can say our treatments are free, it is not only about medicines. We must stop focusing a problem like this in the disease and start to placing the person with all their needs in middle of the care. This pandemic, COVID-19, make us understand that where there is interest and commitment from the big decision makers, when you are facing a problem that affects everyone and not just the most vulnerable population, it is possible to mobilize resources and make medical science advance fast. The vaccines against COVID has been developed in less than a year. And today we have more than 5 vaccines that people can reuse in all the countries. In the other side, only 1 vaccine for tuberculosis was approved in 1927. We're almost 100 years after that. And it's just for one form of tuberculosis, not the most frequent one, that is the pulmonary one. This is just for one form. We still have medication that give us prolonged treatment, and this medication has not changed too much since the last 60 years. But as I told you, it's not just about medication. When a person starts treatment, they must limit their work activity. But many times the person is the head of the family. They live with the money that this person has to earn every day, and they have to decide between their treatment or take care and feed the family. They are vulnerable population that have limited access to care, like persons deprived of liberty, that in addition to live overcrowding with poor nutrition, they didn't have adequate infrastructure, equipment, medicines, or medical personnel. We have the migrants, that they are not allowed to access to regular care in the country that they are in transit or an irregular situation. We have the indigenous population, that the approach of care doesn't take into account their cultural, their language. The stigma and the lack of knowledge make us people lose their job, make young men and women, university students don't allow to get into the classes, make children lose 1-2 years of school classes. Needs are many, but attention given to a problem like tuberculosis is not enough. The population affected by this disease remain invisible, and there are not enough social groups for fight their rights. So this is my passionate, because like you all, I look for equity in health and social justice. And my challenge is to advocate for these persons, to continue placing tuberculosis on political agendas, so health can be given with dignity. So yes, for the man that I find walking in the road, for Ronald, for Veronica, for Hugo, for the migrant caravans, for indigenous population, for those who live in prison, I am motivated to continue working and at this opportunity with the goals of no more people suffering from tuberculosis and not one more death from this disease. Thank you very much.